Hi, my name is Dr. Arnold and I'm a dentist. And normally I'm always looking to help aspiring dentists, newly qualified dentists within their journey in dentistry. But what I wanted to do today was talk about why you shouldn't want to be a dentist. What are the reasons why you wouldn't want to get into this career? And that's what we're going to be covering today. I was speaking with a colleague who's in Australia working as a dentist, and he was just telling me about the difference that he saw when he was a dentist in the UK and now that he's a dentist in Australia. And one of the things that stood out to me that he said was that the respect that people have for dental care professionals is different in Australia. He was saying that, people weren't looking to blame the clinician for something which the clinician was trying to help them with. People weren't coming with, let's say, a mouthful of tooth decay and blaming the clinician for that. People were actually taking ownership of their dental health and realizing that, the dentist could help them get to a better place. So, that really resonated with me in that sometimes you get so used to people that'll come for their dental visits for the first time. And one of the first things that they say is, I hate the dentist. I hate coming to the dentist. And that's just become such a normal thing when in fact, that's actually not a normal thing for people to come to your place of work and tell you that they don't like dentists. So that was one of the first things that I would say is that if you come into dentistry, expect that quite a few people will be telling you how much they hate dentists and be able to handle that sort of thing. In dentistry, one of the things I enjoy is getting to meet new people. I mean, yes, people at first might say that they hate coming to the dentist, but once you get to know them, build a rapport with them, people can actually enjoy coming to the dentist and you get to have some exciting conversations with patients that I've seen. I start to have some really interesting conversations. And that's something that I enjoy about the job. But the thing about dentistry is you're in that one room. You've got your nurse with you as well. It's not really a profession where you're working with a big team in that same room. Yes, you might have other clinicians in the other surgeries or in the other rooms, but for most of the time, really, you're spending it in that one same room with your nurse. So for some people, dentistry can actually be quite isolating. And if you're a person that, you know, wants to be, really social and, interacting and engaging with a lot of different people within your workplace, then dentistry sometimes can actually take you away from that and it can be really isolating. And that's why it's really important that people are having lives outside of dentistry and outside of work. But that's one reason that if you want to be in a workplace where you're always, having the opportunity to engage with your work colleagues and not just be in the one same room. A big reason and a big stereotype about dentistry is that, you earn a lot and you're extremely rich, extremely wealthy. Now, yes, dentistry can and does pay well, but the fact is the pay can be really unpredictable in dentistry. And if you're not great at handling finances, and if you're spending everything that comes in, then it's likely that you probably will get into some financial difficulties as a dentist, maybe ending up borrowing quite a lot to maintain a certain lifestyle. And this is just the reality of working a self-employed job. You can have some months which are extremely great, and you can have some months which are extremely low. You might have a month, for example, where your lab bills are extremely high. I had a month one time where I had £9,000 or £10,000 worth of lab bills in that one month that had to be paid. And you don't see much income from a month like that because you've got so much going out in terms of lab bills. So, in dentistry, the pay can be really unpredictable at times, unless you're in an employed role as a dentist, which is normally within the hospital. Unless you're employed, most dentists are self-employed. It's going to be really unpredictable with your pay, and you're going to have to be very disciplined to sort out your own savings, disciplined to sort out your own, income protection, which is going to be a high enough cover for you if you can't work, and disciplined to sort out your own pension, because once you're private, for example, you're going to have to sort out your own pension as a dentist. So that's one thing I would say. If you're coming into dentistry, or dentistry for you was a way to get wealthy, then it might not be so straightforward, and you might be disappointed by what you actually find when you start to think about the hours you work to try and get a certain income level, and the stress that you're under from the types of work that you're carrying out, treating patients. If you're going to be earning a lot within dentistry, you're going to be carrying out some really advanced dental procedures, and with that comes a lot more pressure, a lot more stress. So again, it's thinking, is it going to be worth all of that in terms of coming into the career just because of a financial gain? Following on from the vision, or this picture that people have of dentistry as a way to make money easily, things have changed. Before, you could set up a dental practice in most areas, most places, and there would be a load of people that would come to that dental practice. Things have changed now, particularly within private practice. You need to be able to actually market yourself in terms of people being aware that you're there, people coming to see you because you provide fantastic work, and you've got a presence online where people can then choose to come to your clinic over any other clinic. And now that people have got choice, and people are much more picky about who they go to see, it means that as a dentist, you now have to think about online presence, reputation, branding, all of these different things, marketing, that before as a dentist you probably didn't have to think about. Previous generations probably didn't have to think about in the same sort of way. Unless you go work in a practice which has already got a reputation, or for a clinician who's already got a big reputation, as a new dentist, you're going to have to build that reputation, build that presence in your community. So there's a lot more work that goes into you being a successful dentist than there probably used to be in the past. Now, dentistry is a bit of a funny one in that technically you can choose to work as little as you want. You can choose to work when you want, and you can take as much holiday as you want as a dentist. Now, what tends to happen is, over the years, as you build up a list of patients, if you wanted to take, let's say, 4 weeks and go away for 4 weeks, who's going to handle your patients? Who's going to finish off the treatments that you had started? Who's going to see any emergencies for your patients who may need emergency care whilst you're away? So this is something that makes it actually quite difficult for self-employed dentists to have a long period of time away from work, because unless you're in a clinic where maybe there are other clinicians who are happy enough to take on your patients while you're away, or maybe there's another practice that can take on your patients while you're away, then you start to feel quite trapped in that you can't go away for long periods of time because your patients are going to need that continuity of care. So in some instances, you can actually end up overworking, working long hours, long days, working more than 5 days a week, and having very little holiday throughout the year because your patients need to be seen to. So that's actually one thing that can really be a common thing within dentistry, in that you actually work more, not less, compared to somebody who's employed. Well, I hope those 5 reasons have given you something to think about on why you maybe shouldn't be doing dentistry or pursuing dentistry as a career. But if after all of that, you still feel like dentistry is for you, then do check out my other videos where I talk about the realities of dentistry and what you can actually expect to enjoy from dentistry. I'll see you guys at the next video.